Hello again. My name is Jason Perkins and I'm a Georgia workers' compensation attorney. I'd like to welcome you to another edition of my Georgia workers' compensation video series, where I provide you helpful information about Georgia's workers' compensation law. Today I'm going to discuss FCEs, or known as functional capacity evaluations, with you. But before we jump into that, be sure and be on the lookout for my upcoming video in this series about how temporary total disability and temporary partial disability benefits are different under Georgia's workers' compensation law. Now, let's talk about FCEs. An FCE, or functional capacity evaluation, is a test that's normally performed by a physical therapist. In some instances, it can be performed by a doctor. The test is normally ordered by your treating physician. And basically, a functional capacity evaluation is a test that tries to determine what you can and cannot do as a result of your injury. In other words, what are your functional capacities, or what should your restrictions be? The test will run you through a whole series of lifting, sitting, standing, pushing, pulling, carrying, bending, squatting, climbing. Basically, they try to do anything that you might do in your job. The test attempts to provide an outline of what your limits are. In other words, can you lift 10 pounds, 20 pounds, 50 pounds? And how often per day can you do that? Should it be something you only do occasionally, or can you do it frequently or constantly? The test itself is going to ultimately provide a report that your doctor will receive that lays out all of what your limitations are as a result of your injury. So it'll say how long you can stand, how long you can sit, if you can climb or squat, and how frequently you should do that. It'll also have recommendations about how much you can lift or can carry. And this test is then used by the doctor most of the time to set your restrictions. These may often be permanent restrictions that you'll have as a result of your injury. In most instances, the functional capacity evaluation is not performed until the doctor has placed you at what's called maximum medical improvement, or MMI. And doctors like this test because it often helps them have some sort of objective measure almost of what your restrictions should be. Instead of the doctor just guessing at what your restrictions are, they can rely on the test results. Another important thing to understand about functional capacity evaluations is that they try to determine whether you give your full effort or not. That's called validity testing. In other words, there are certain things built into the test that test whether you're really trying as hard as you can or not. So if the examiner asks you to lift something that weighs 20 pounds and you go, ugh, and say, I can't do it, they don't just necessarily take your word for that. There's things built in the test to determine whether you're giving as much effort as possible. And if you don't give as much effort, then many doctors will not rely on the test results from that. And sometimes doctors will actually release you to full duty based on an invalid test. So that's something to watch out for and be careful about. Now, I myself am not contending that functional capacity evaluation tests can necessarily accurately determine whether you're giving your full effort or not. But if your treating doctor relies on those tests and believes that they can, then often that will be something that you certainly need to consider. Because if the test determines you don't give your full effort and the treating doctor releases you to return to work without restrictions, then that will definitely affect your Georgia workers' compensation benefits and whether you're still able to continue receiving them or not. Hope you